to wearing a mask. Just ask the mayor of Sioux Falls, all 10 cases. This is cowboy country, man. You try and tell someone to do something, and they want to do the opposite as a result. The mayor resisted a mask for months, but the city finally passed one, and over the weekend it took effect. But there is no penalty for those who refuse to wear one. Most people we saw in the downtown area of bars and restaurants were not.
WCBS is David Beckner reporting from the Jefferson Bank and Trust business desk. Clayton-based Polaris is closing most of legacy naturalizer retail stores, 133 by the end of the year. A few locations will remain open, but the company says it will focus on e-commerce. The news is sponsored for you by English Sweet Chimney Service. We assault vehicle 270 southbound half Page Avenue, that's on the right shoulder. Assault vehicle 44 eastbound half 270 off on the right shoulder. A look at the Exergen weather forecast. Plenty of sunshine this morning, but clouds moving in, and we could see a spotty shower later this afternoon into the evening. 48 will be our high, 42 overnight, and tomorrow a few showers to start and a high of 54. Sunny and 43 degrees. Right now, the weather is sponsored by Cancer Injury Law. As more cars return to the road, it's imperative to exercise caution. If you're injured in a car accident, call Cancer Injury Law before speaking to the insurance company. 314-628-9999 is more faster than the cancerinjurylaw.com for your free consultation. The Dow is currently up 207 3/4 points. I'm Debbie Monterey, KMOSD.
Yeah, for the previous vaccine announcement, the Dow is up 400 points, 900 points, 1,300. I guess we're already getting whole hums with vaccines. The Dow's only 200 at this point.
That's because of the 70% rating. Remember how I said we're all turning into Olympic sports viewers with the vaccine? You watch the Olympics, you're like, look at that guy, he's slow.
Now, did they revise it up to 90% again, right?
Oh, is it 90%?
I thought I saw that, but maybe I'm wrong. But I thought it was amazing when the CEO of CBS was on Margaret Brennan's Face the Nation yesterday, Amy.
Hi, folks. Is the microphone pick me up? Yeah, the microphone picks you up.
In 72 hours.
Not that bad.
24 hours for delivery.
Not that bad.
Day or two to start shooting the vaccine.
So let's see, this is the camera over here. This is my screen over here. Yeah. Okay, if I'm over here. Let's see, I can set my TV. I go to my channel.
I did see another story that just noted the vaccine for
Yeah, so to your channel and your TV. And you'll be on both screens. Hey, it's my lunch show. Already had a piece of fucking pie.
Yeah.
I got a turkey on.
That's exactly what they're saying. That's exactly what
Honeysuckle.
That's great news for sure. I'm thinking.
It's all white.
Doing an interview with.
It's honeysuckle white, and then it's gonna. What I'm gonna do is it's frozen, so I got a Betty Crocker roaster, and it's gonna be like slow cooked at 225. I don't know. Get some gas for it. I'll take it off. About 11. About 11. Oh, we're on TV now. We're literally on TV right now in our house. We're like, what are we doing? We're streaming this show.
I know it should be on radio.
We are streaming a show. We got KMOX on. So, regardless of like the FCC's interference, we are able to communicate. The FCC's like, hey, maybe you don't get to communicate. Well, maybe we do. Let's see, search.
I thought it was still uplifting.
I was the first caller who was asking about that Disney court, which I was going to ask, but I thought it'd be too messy to deal with other, but I had no idea what they were talking about.
So now I got what I gotta do on Twitter and say go to Michael Mullarkey channel on, what is it, YouTube? Yeah. And then what they're gonna say, hey, it's paying for that. You don't have to, we'll let you promote your channel.
Interview to the radio hall.
I gotta rate leagues and pay for it. I know, you gotta rate leagues and pay for it.
It is the Hall of Fame of my heart, Charlie.
Go ahead, here you go, because I was on the radio.
We're going to talk about the Pace Turner only in St. Louis, and that's at about 10:20 this morning. And in a minute, we have the wine line for this Monday morning. at 314-444-3000. But first, John Morelli.
This is am I going live?
314-444-3000. But first, John Morelli.
This is am I going live?
314-444-3000. But first, John Morelli.
It's a bit delayed.
At 314-645-1387. Although we had a relatively mild fall and
So I'm making Cheerios a fortune, huh? Yeah, you're making Cheerios a fortune.
ripe tomatoes.
That's what real life.
So it's quite possible that John could start a cut point project.
So like I'm delayed, huh? Yeah. Like a sinking solvent?
He won the Better Business Bureau Torch
Sinking
Award.
won't solve it.
He started this business with his lovely wife Cindy in 1991, and now his daughter Deanna and her husband
Like this the U channel?
there, along with a lot of other employees who are kind of like family. 9 out of
What,
10
YouTube gonna
jobs
sue me now?
are
YouTube's probably not gonna sue me. Right? Because it's a U channel, huh?
including the aforementioned
Okay, it's like you.
CBS.
It's a show about you. It's a show about nothing. Instead of a show about nothing, it's a show about you. Well,
What's on your mind? Get it off your chest.
change the show too much, huh?
I'm around Emmanuel.
It's not the way it is.
Pretty much so after 75. That sounds like a step of the target you made.
It's pretty much delayed.
I don't know if I go that far, but
I watch a video on my channel. This is live.
Atlantic and elsewhere. Written by
You turn my house a little while.
bioethicist if you can. It has been very controversial. We're getting some very intelligent.
Well, I could get another monitor. Well, I can't get 2 monitors. What do I gotta do to get 2 monitors?
To
My simulcast live.
a longer segment. So we didn't
You don't need simulcast live.
article. Email me. I'll send you a link, or you can just Google it. I'm sure. Ezekiel Emmanuel.
So,
And
like, I went to the live thing on YouTube, and they're just like, hey,
I will point out,
you know,
Anthony Fauci is 79.
news, that's it.
I think the president-elect is also.
So when do I run out of like gigabytes or something? You know, you go like,
Nancy
wow.
Pelosi is 80. Ruth Bader Ginsburg was 90, wasn't she? And Mitch McConnell was 78, 79.
So is that like, do I want to move the camera? There's the camera where it is.
Modeled as well because he
Let's
did.
turn the light off.
You know,
Turn the light off,
I read the Atlantic article to see that he was focusing primarily on.
Microphone on? The microphone's on. Sound test, 1, 2. Sound test, 1, 2. We hear you, Mike.
To explain his definition of what a meaningful life means, and not only did he imply that
Oh,
life is not meaningful,
but I heard
but
this.
you have those.
You didn't invent a pad on this?
Even if you're
You don't have a pad on
there's
this.
not a lot of meaning and purpose in your life.
Oh.
So I think there's.
Was the view on that?
Your
If I got a
worldview,
pad on,
I
why would I
think
watch it?
that will determine whether or not you
Watch me watch the video?
or agree or
The
disagree.
TV wouldn't like,
And I think it's a great topic.
the TV's like, hey, well, I'll watch more Rachel.
We're going to show you how you can.
Thanks for the rush. A reasonable facsimile. We know you should come to a restaurant where we're a reasonable facsimile. We're not used to cooking. We'll stop sparking. Should I look like full bread?
Wow, this must have been a really slow news day. I don't know.
More than fair, all you have to do is stop. I think most of this car, all you have to do
We'll
is
stop.
and
There's a jam on some. We'll stop jamming you guys.
I've had many a person say that.
Let's see.
Mr. Hyland will be
There's
running over
conspiracy.
Okay, it'll be open
Oh,
for
it's
several weeks,
conspiracy.
but every restaurant restriction in the county, you do have to get your food
See.
to go. You can place your
You can
orders
watch,
on
you know.
the Kitchen Taco website.
It's a conspiracy.
I'm seeing that all over my social
Now
media,
Channel
and I
5 works.
cannot
Now
wait to
NBC
try that.
works.
Alright, well, just ahead, folks, we work in
Now
some
NBC
how
works.
to do the taxes right here. We talk to the experts to see if you'll have to pay us, we're not going into the office.
Watch me watch that.
all right, it's the season.
We'll watch you watch
Pick up a
that.
Christmas tree. This is a Kirkwood Farmers Market.
Sounds very
They've got
right.
their trees.
There you go.
There you go.
You know,
Talk about the forecast.
I didn't even enunciate, articulate my jet. Do enunciate, articulate the question. Mumble.
Mommy,
He's
the
confident.
airline's having
He's
been
not
offering
mumbling so much.
Thanksgiving discounts this whole time.
Hey, who's on? Conspiracy will be here soon. Conspiracy will go away. Okay, I'm kind of got one. Yeah, like a clear TV. I'm telling you, go for shit yet. Nope.
That's it. When they say,
Well, you got
You don't get believed. It's a clear TV. Why do I start on my TV?
another version.
I like extra loud and everything. What's it like? Oh, wait a minute, she just
And
fell
I know we
south.
have to take the break, but there's
So
one
watch me
more
do
chat
that?
on the way.
Yeah,
With
she's
guest
been watching
co-host
it.
and Michelle Bathey. Don't go any. The real.
That's an extraordinary offer. Only in St. Louis retail for $24.95. That's the suggested retail, and he's offering a free dozen donuts at the Cowville and Florida locations.
Okay, let's see. Can you guys see me in the kitchen? What is it in the kitchen?
now it's
You guys see me in the kitchen?
So
that's loud.
Yeah, I think it's a you just renewed the president-elect. It's a fair technical point because it's until sometime in December when the electors officially make him president of the inaugurated on January 20th. Fair question. But you know, this last night to Joe Biden. And
It's good till about 3 o'clock. It's class.
It's what you do.
So you watch, talk about shutting down restaurants, rather than shut down, winding down on, I think that's what they will. I think we should, that be the only way to do it. In that case, it's out there, and, let people on their personal responsibility, sounds like they're by the president of town, but we keep on.
now.
Here's our,
First,
and then proper roaster. Yeah, General Electric roaster. That thing, that's just too big for me to carry home.
Friday, and it says, we're gonna talk about Rudy Giuliani.
It always just food tea outside. It's gonna it's for a segment where
Is there anything there? There's something. So are we atrophying? We're not atrophying yet. I gotta go to the coffee. It's kind of like commandeering a coffee table from the couch. But hey, this is my chair. Yes.
Dave Marsh.
Good morning there.
I don't think keeps dropping mine. Or it's like whatever TV works.
birds might be missing from the White House after January 20th.
See, what happens is that everything works. Yeah, I lost them. Well, that's that.
Was listening in, so the Prime Minister set out the new tier system, a tougher tier system that will come into effect. Lockdown ends on the 2nd of December. Beth, and just explain to us what it will mean.
Well, Sarah, there's so much detail, isn't there, to go through, but in the big picture, I think the message here is that the national English lockdown will not be resumed after December the 2nd. The Prime Minister very clear about that. We will move into a tier system, but that will last until the spring. It's going to be a long road ahead. Some glimmers on the horizon, of course, in terms of not just the vaccines, but also testing. The Prime Minister talking about the hope of maybe having more effective testing to try and release people from isolation more quickly. But I think the big picture there, the big message to all of us is that this is going to be a long road ahead before we start living more normally again. And in terms of the actual tiering system, well, you heard Mark Harper, who's chair of the COVID recovery group of MPs. Interesting, the Prime Minister saying that he'd met with those backbench leaders of that group, the unhappiness plain to see. He's saying there, Mr. Harper, that Tier 3 doesn't seem that different, does it, to the English national lockdown. And the big change in the tiering system is that in terms of hospitality, if you are in Tier 3, all the pubs and restaurants remain closed. You can go for takeout, but you cannot go and sit in a bar with your family and have a meal. Indeed, that kind of freedom is now brought down to Tier 2, where you're allowed to go out and sit with your family and have a meal, but no alcohol unless you're having a proper substantial dinner. So the government there really tightening up the tiers, and there was another sting in the tail, wasn't there, when the Prime Minister said, "I'm afraid to tell you that as we toughen up the tiers, also more of the country will be in the higher tiers." So it's going to be quite restrictive.
Beth, I'm going to interrupt you. Matt Hancock, the Health Secretary, is standing in and continuing to answer those questions while they re-establish communications with the Prime Minister.
It is necessary to be able to get the R down under the tiered system to avoid further national lockdown if the cases still go up. And as we've set out, we have seen some areas of the country see the case rates come down, and now, thankfully, nationally, we're seeing the case rates come down. Now, to his final point about the other health and economic impacts, we of course recognise the economic impacts. But the other health impacts, I would simply reiterate what I've said many times before, which is that the health impacts of not locking down and of the spread of the coronavirus going forward on other health conditions other than coronavirus are also bad. And the best way to protect the health of the nation, both from coronavirus and from all other conditions, is to keep the virus under control.
Thank you, Mr. Speaker. I think it makes the case for investing in broadband. Can I ask the Secretary of State, though, very seriously, from the lack of tests and PPE, the claims about a protective ring around care homes, while people died in horrifying numbers, the government's abject failure to protect care home residents and care staff has been one of the biggest tragedies of this pandemic. So will the Secretary of State guarantee today that no care home will be required or pressurised to make anyone from the NHS hospital who has tested positive for COVID?
Well, Mr. Speaker, we have over the summer put in place a new regime for ensuring that people who are tested positive but need to go to a care home can get the support that they need in a way that protects them and also protects other residents. And that means that nobody leaves hospital without a test, and those who do need to leave hospital with a positive test must be isolated in a CQC-approved isolation. And we do, of course, need to support people who tested positive, and hospital is often not the best place for them, but we need to do that in a way that protects all other residents as well. And at the same time, I'm delighted that we're able to announce today the expansion of the availability of testing for care homes, for domiciliary care workers as well, and also care home visiting, which I know is hugely welcome.
Mr. Speaker, we've seen huge efforts across the Stoke-on-Trent to get COVID rates down. The City Council have done an excellent job at rolling out testing. Rates are now falling locally, so do everything possible to ensure support continues to be given to local health and care council services so we do not exit lockdown at the highest tier. Well, I pay tribute to everybody in Stoke, the council, the Royal Stoke Hospital and the wider NHS, and the three colleagues in this house who represent Stoke, including my honourable friend, who have worked so hard together to get high quality public health messaging out. We can see the cases coming down in Stoke. And as the Prime Minister said, on Thursday we'll take decisions, we'll announce decisions taking into account the very latest data of which areas fall into which tiers.
And Taylor Swift will do it too.
While millions will welcome the will now be able to shop,
worship,
and associate with friends and family over Christmas. Does the Minister not realise how alarming this statement is today? Not only being grateful for an announcement which allows us to exercise some basic freedoms, should we not be alarmed that the dependence which normally people expect from democracy now rests in the hands of a minister and the state? And will we accept that this statement will still deny people the right to earn a living, will drive millions into poverty, and will still instill fear, and that's going to indicate this policy is a wrong track.
Mr. Speaker, the first duty of any government is to keep the citizens of the country that we serve safe, and that is the reason that we take the actions that we do.
So it would lead. I hope the Secretary of State will think this is centric. If I say that on a winter's morning, I'd start my day by switching the certain time and then going to the maths. And of course, he's now abolished both those things for the last 4 weeks. And more important, abolished them for hundreds of thousands of people. So my question to him is this, that under any tier, or indeed under any future lockdown, we will never return to the abolition of healthy outdoor sports or going to religious services. It would be the shred of evidence that they cause any problem. By the way, this is the first time in 80 years that people are going to church in this country since the country put under the illegal smoke. So we do want reassurance on that. And as we're having this conversation, we can give us some more reassurance about Christmas carols. We don't want it to be just a holy night, but we don't want it to be a silent night.
Mr. Speaker, I very much hope that we won't have another national lockdown at all. It's one of the reasons that we toughened up Tier 3 is to ensure that if areas are in Tier 3, we can get the virus coming down as opposed to just flatten at a high rate as we were seeing before. And that way, I hope we can prevent the whole country from ever having to see the sorts of restrictions that we had to bring in order to keep people safe.
It has to be said that news of the 3 vaccinations brings us a much-needed dose of hope as we face the winter months. And of course, Wales is especially vulnerable to COVID-19 because of our older population and our higher levels of deprivation. Will the Secretary of State ensure that Wales receives a sufficient allocation of vaccines based on need and not per head of population?
It's absolutely vital that we vaccinate fairly across this country, across the whole of the UK, according to clinical need. That is the agreement that we have reached amongst the 4 nations. It's the principle that I am determined to follow, given that the UK vaccination programme is obviously across the whole United Kingdom. And we've therefore, on that basis, agreed a fair allocation of vaccine, so that vaccination can occur at the same speed in all parts of the country, according to clinical need.
We're heading to your quota, or we hope to be, with Julian Sturdy. Julian Sturdy.
Thank you, Mr. Speaker. Given the big sacrifice,
he put them in a brown paper bag, Guppy Bush did, handed them to Kennedy, and said, "Here, this is from St. Louis."
Quote, a joke. In the letter, his legal team said, President Trump and his campaign continue to insist on an honest recount in Georgia, which has to include signature matching and other vital safeguards. Georgia Secretary of State Brad Raffensperger, who is also a Republican, said the state's voting system has never been more secure or trustworthy. He also ensured all ballots with signatures were verified twice. County election officials have been notified of the recount, which will be done using scanners that read and tabulate the votes. For Newsy, I'm Antoinette Miller. The first picks for President-elect Joe Biden's cabinet are slated to be announced this Tuesday, despite Trump administration blockades. The next president's chief of staff would not share which positions would be announced. The Associated Press reported he could name his nominees for Secretary of State or Treasury. Biden has vowed to create the most diverse cabinet in modern politics, with women and people of color being considered for several positions throughout the government. Nominations are moving forward despite the Trump administration's unprecedented refusal to ensure a smooth transfer of power. President Trump is fighting his election loss to Biden and withholding information that would provide a peaceful transition. Politico reports a number of Republicans are signaling that most of Biden's picks will be confirmed, with Senator Lisa Murkowski of Alaska saying, quote, "Our role is to make sure that he selects folks that are within the mainstream." For Newsy, I'm Alex Arger.
Cup of whiskey, you say? Well, this blend of fine golden grain and single malt comes from the oldest distillery in Ireland. Because we are not here to take part, we are here to take over. So we're up our number 12, Irish whiskey.
Online dating? I know people meet that way, but where would I even begin?
Open laptop, go to OurTime.com, look for free. It's easy to take a look on Our Time, the fastest growing dating site for people over 50.
Online dating? My buddy met a nice woman that way, but I'm not really sure where to look.
Pick up your phone, go to OurTime.com, just take a look. It's easy to take a look on Our Time, the dating site for people over 50.
The average person can go 4 hours on a filler. Others can go for days. Discover the Toyota Venza with class-leading MPG.
Sunday, Baker Mayfield marches the 3-1 Browns into Pittsburgh for a battle with Big Ben and the undefeated Steelers, while the Broncos look to bounce back against the Patriots. Sunday, the NFL is on. Yeah.
I'm Steve Austin, I'm looking for the toughest badasses in America.
It's competition. It's a lot of sport on CNN.
I'm ready to go, man. Anything go.
Right now, the curve is like that.
Dr. Anthony Fauci, the nation's top infectious disease expert, urged Americans on Sunday to do a serious risk-benefit assessment before traveling for Thanksgiving this week, as the number of U.S. coronavirus cases surpassed 12 million, rising by more than 1 million in less than a week for the first time.
In general, what I would recommend, and I do this every day, Margaret, is to tell families to just take a moment to do what I call a risk-benefit determination. If I have someone in my home who's elderly, someone who has an underlying condition, do I really want to put that person at risk from someone who innocently or inadvertently could infect them? Because we know clearly that people who don't have symptoms are clearly capable and are transmitting the infection.
Fauci's strong recommendation during an interview on CBS's Face the Nation came as COVID-19 deaths topped 255,000. And Fauci warned that deaths could rise to over 2,000 a day in the coming weeks.
These numbers.
Average pump price over the last few months is more than 8 cents.
And now turning to the latest on the COVID-19 crisis, as officials warn against large gatherings ahead of the holidays, more states are putting tougher restrictions in place. In Los Angeles County, for example, due to the increase in cases, local officials announced a new ban on dining at restaurants and bars. That starts this Wednesday. This, as breaking overnight, California's Governor Gavin Newsom announced he and his family are quarantining for 14 days after being exposed to COVID-19. And in Texas, after months of staying apart, 15 members of one family have been infected with COVID-19 after spending an afternoon together for a birthday party. Our team of reporters are out in full force with the latest on the coronavirus across the country. Ellison Barber in St. Paul, Minnesota, Valerie Castro in Cleveland, Ohio, and Tom Costello in Washington, D.C. Good morning to all of you. Thanks for being here. Let's start with NBC News correspondent Ellison Barber, who joins us from a hospital in Minnesota, and NBC News reporter Valerie Castro
Castro, who's outside the Cleveland Clinic in Ohio, two states where the virus continues to spread at alarming rates. Allison, now on Sunday, another 7,200 COVID-19 cases were reported in Minnesota, where you are, bringing the total case count in that state to more than 270,000. What kind of a toll is this taking on hospital resources where you're at in St. Paul? How's the healthcare staff doing?
Lisa, but you look at those numbers and they do not lie. The situation here is serious and there's no indication that things are getting better. There were maybe 2 days last week where we saw the daily rate of new infections drop slightly, but hospitalizations as well as the death toll has not only risen almost every single day here in the last week or so, it has broken records. I just finished talking to one of the doctors here at Regent's Hospital, and he said not only are their beds and their ICUs filling up and getting close to being in a dire situation, but he says their staff, they are tired, they are exhausted, and a number of people here at this hospital that are either at home quarantining or at home because they themselves have COVID-19 symptoms. And that's one of the big things to remember when we're talking about capacity and hospitals being strained right now. Is it's not just the number of beds, it's not just the ability they have to expand their beds. There's a paper plan, which is what this doctor told us, and then there's the reality. And at a certain point, your staff, if you don't have enough staff to treat the number of patients coming in, then there's really not much you can do. They say right now, not only are they seeing a massive increase in COVID-19 patients, but they say they are also seeing a lot more people who maybe delayed care for other ailments a little earlier in the pandemic starting to now come in. And when you combine those two things, they say things here are really getting to a point where if there's not a massive change in the next week or so, things could become catastrophic and dire. Savannah?
Oh my gosh, and of course it's right as we're heading into the holidays, so we might see that spike like we have after other holidays. Now, Valerie, I want to ask you something similar about in Ohio. They've reported nearly 25,000 new COVID-19 cases since Friday. It's Monday, and that's weighing heavily on caregivers there. How is this affecting frontline workers at the Cleveland Clinic? What are they telling you?
Well, good morning, Savannah. And those new COVID-19 cases actually include healthcare workers. Here at the Cleveland Clinic, about 1,000 workers are out right now. They're either home infected and trying to recover, or they've simply been exposed, and now they have to quarantine, that 2-week quarantine period. And we're told that exposure may have come, obviously, from the nature of their work here at the hospital or simply being out in the community. Of course, that puts a strain on this hospital, but other hospitals are seeing the same problem. The Ohio Hospital Association says 20% of healthcare facilities across the state are now reporting a staffing shortage. A doctor here at the Cleveland Clinic tells me that when that happens, other doctors have to be pulled in from different services to help fill in the gaps as needed. That same doctor, I asked her what's surprised her the most over the last few days and weeks, and she says what is shocking to her is to hear that people are still planning those large Thanksgiving gatherings. She said she's heard of people planning groups of 20, 30, 40, and despite the warnings, and so she has some advice for people at home. Here's what she had to say.
What I want people to do is I want them to make this really personal. I want you to think about the 5 people in your life that you care most about. How can you, over the next month, best protect them? If you don't want to be doing, wearing a mask for your own health, think about those 5 people. And if you want to see them next Thanksgiving or the next holiday season, how are you going to protect them? You don't even have to think about the whole community. How are you going to protect your mother, your grandmother, your sister, your children?
Some really strong words of advice from that doctor, and she says if you feel like you're letting down family members, if grandma is really upset that you're not going to come, she says blame it on her, blame it on the doctor, so you can make sure everyone is safe. Savannah?
And of course, this time of year in Ohio, as evidenced by what you're wearing, it's not exactly warm. So that's going to be those 20, 30, 40 people likely inside at someone's home. I mean, that's just not what we're supposed to be doing right now. Now, Ellison, Minnesota called on the federal government's help last week to provide additional ambulances to the state, yet another resource that is strapped. What can you tell us about that?
Yeah, the state asked FEMA to send them 25 ambulances to help kind of really with 2 different things. On the one hand, it's to help ambulances and EMS workers who are overburdened right now with 911 calls, mostly to do what they call inter-hospital transfers. The goal of that being is, somebody is in a rural hospital and needs to come come move in closer for care, that would take an ambulance out of service for quite a while. So they need to drive 2 hours away and then 2 hours back. That could be an issue. We have so many ambulances needing to go out on calls right now. So we needed more ambulances to help with those sorts of transfers and also to just physically move patients to free up room. I was talking to the doctor who oversees the ambulance services at this hospital, and he was saying they have had to divert some patients. They often will have to do that, but right now they are having to divert some patients because of COVID-19. And the idea behind that extra help from federal ambulances is that they can come and they can help move patients who maybe aren't as critical care levels from some of these hospitals that have big ICUs, more capabilities than other rural hospitals, move patients that are more stabilized out to those rural hospitals, and then free up their ICU beds and also their surge beds and capacity at hospitals like this so that they can make sure they're treating the influx of patients.
Now, Valerie, in an effort to get the virus under control in Ohio, this was the first weekend of an overnight curfew put in place by Republican Governor Mike DeWine. How are people across the state handling this? What's the reaction?
Well, Savannah, as you can imagine, some people are not very happy about this new curfew, and there was actually a rally over the weekend in Mentor, Ohio, called the Rally for Freedom. It was a small group of protesters. No one there wearing masks, but they say this curfew doesn't make sense. The governor says it really is just meant to limit person-to-person contact. The curfew went into effect last week. It means that non-essential businesses should remain closed from 10 p.m. to 5 a.m. and residents are encouraged to stay home during those hours, only leave for essential needs like going to work or getting supplies. And that curfew is set to expire on December 9th. Savannah?
Allison and Valerie, thank you so much for your reporting and stay safe.
There's breaking news overnight on the vaccine front, so let's bring in NBC News correspondent Tom Costello for more on a look at how quickly Americans could start getting vaccinated against COVID. Tom, good morning.
Yeah, hey Joe, good morning to you. So the short answer is we could see needles in shoulders within about 3 weeks.
Let's put it down a little bit. That's fine.
This morning, coming out of the UK, is that AstraZeneca, which is partnered with Oxford University,
I messed up. Now,
very good results out of their vaccine, and so that now
don't get us in a fight to do it.
very quickly.
They're over there, you like to go there.
This morning, Oxford University
They're over there, you like to go there.
their vaccine candidate
Really like them for
is
business.
effective in protecting
Go over there and go down.
That's most of the vaccines from Pfizer have recently showed 95